My name's Allison Ramiller, and I'm one of the Empowered Health Cancer-Free Challenge panelists. I'm excited to be with Carol Sorsoleil today, one of the challenge winners. Great. So I just, first of all, wanted to ask you, what is your personal experience with cancer?
When I was 49 years old, I was diagnosed with cervical cancer. And I remember the thoughts I had it seemed like everything in my life was on hold. It forced me into a serious reevaluation.
That's an experience that I think we've heard a lot of people who dealt with cancer describe, just the overwhelming feeling that you get with that diagnosis. How did you cope with that feeling?
I did a lot of reading, tried to learn as much as I could about the type of cancer I had, but did a lot of serious thinking.
And then how did that experience inform what your overall idea is around empowerment in cancer care?
I feel that people who've had that diagnosis and come through it, I think everyone must be overwhelmed by it. And I think that it's helpful not only to the person who has cancer to know someone else has been through it. I think it's helpful to the person who's helping them.
It's amazing that you don't want it to end with that you came up with an idea on how you could take that model of support and friendship and information seeking and empowering someone to find solutions to a really overwhelming, difficult problem and make that into something that could help the broader community. How do you believe that this will empower those that are dealing with cancer?
Well, I think it's encouraging just to talk to people who have had cancer, and I probably felt that way myself, is that this is a death sentence. And it's not. I think that if you talk to someone who's had cancer, begin to understand there's different ways of looking at it, and it's not necessarily the end of the road.
And so why do we need your idea and this kind of solution for empowerment in cancer?
I think a lot of people don't even understand sometimes what they're being told, and it's just so overwhelming. Each person who has cancer, they have all their other problems as well, and so giving them some understanding and support, letting them know that they have decisions to make. And I think the more people that are involved in this process, that the more options and things that we will be able to generate to help people.
I think together we can all do so much more. And like you said, everyone can bring their own kind of expertise to the table. And so what do you hope your idea will achieve, as you think down the road when it evolves from an idea to potentially a network of volunteers helping people?
Well, that's what I'd like to see. If there's any way to give priority to people who have, either missing support networks or inadequate support networks, to help them have people who they feel are there for them. Because it is really overwhelming. Just that word cancer is so scary.
That's really, really powerful, getting all those advancements and information into the hands of people that are extremely motivated, which is the person dealing with cancer and their loved ones and their friends, and finding a solution together. Ideas like this one will help CDC and the CDC Foundation develop tools for the Empowered Health Program and improve cancer outcomes for all.